Hello, what is the drug filbastrin, or brand name Addyi? I'm going to be discussing this more as a health-related view, and not as much as the opinions or how Addyi may affect human peer bonding interactions and sexual relations. All my sources will be listed in the description box, but let's now talk about Addyi. Then, 17 years after the FDA approved Pfizer's Viagra, the first drug to treat low sexual desire in women, has won approval from the U.S. FDA. Addyi, or filbastrin, produced privately held by Sprout Pharmaceuticals, will only be available through certified healthcare professionals due to high-risk safety issues. What's the status of Addyi's approval, and what was the process? Did it go through the FDA? On June 18, 2010, a federal advisory panel to the U.S. Food and Drug Administration, the FDA, unanimously voted against recommending approval of Addyi, citing small effect and risks of long-term use. Earlier this week, a FDA staff report also recommended non-approval of the drug ahead of the votes. On June 27, 2013, Sprouts Pharmaceutical confirmed that they had resubmitted Addyi for FDA approval in December 2013. A formal dispute resolution was filed, which contained the requirements FDA for further studies. These include 2 studies in healthy subjects to determine if filbastrin impairs their ability to drive and determine if it interferes with any other biomechanical pathways. Sprouts expected to resubmit the new drug application in the third quarter of 2014. On June 4, 2015, the U.S. FDA Advisory Committee, which included the Bone, Reproductive, and Neurological Drugs Advisory Committee and the Drug Safety and Risk Management Advisory Committee, recommended approval of the drug. 0 voted to recommend filbastrin with label warnings, and voted filbastrin with the inclusions of risk management options beyond labeling, and 6 members voted against approving the drug. On August 18, 2015, the FDA approved Addyi for use in improving female sex drive. However, additionally, during the approval process, Sprouts Pharmaceutical launched a campaign called Even the Score to pressure the FDA to approve Addyi. The campaign emphasized that several approved treatments for male sexual dysfunction exist, while no such treatment for women was available. Since the approval, many have recommended that this drug is dangerous. There's increased risk of severe hypotension and temporary loss of consciousness when alcohol is consumed. This is a high risk considering that Addyi will be taken daily at bedtime, so patients who consume alcohol even occasionally will have an increased risk of these known side effects. Some adverse events were reported among the test group from women taking Addyi. The majority of adverse events were mild to moderate and resolved during treatment. The most common reported adverse event was including dizziness, nausea, fatigue, sleepiness, and trouble sleeping. This drug was designed to treat hypoactive sexual desire disorder. This drug has been rejected twice in the past for safety and effectiveness. There are many doctors that oppose this recent approval and argue Addyi's results. They did not find anything promising and concluded that Addyi is probably no more effective than a placebo for most patients. Unlike Viagra that affects blood flow to the genital region, Addyi is meant to activate sexual impulse in the brain. Addyi is the same class of other drugs as selective serotonin reuptake inhibitors, or SSRIs, that include antidepressants such as Prozac. However, these antidepressants, which raise levels of neurotransmitter serotonin, are known to dull libido. Addyi will block certain cellular receptors responding to serotonin. Would it not be better to increase libido instead of using brain-altering chemicals to consume natural forms of aphrodisiacs from food sources such as chocolate or ginseng? Color therapy has also been used and has shown great promise, and it's known that the color purple increases sexual imagination, and these are all better choices than a toxic drug. To stay healthy, it is recommended that sexual interactions and more sex is good in the age of increasing stress. Sex is a mental health tonic, and some argue that it has better results than Valium due to the surge in key hormones including oxytocin, and after sex people are better able to let go of distracting thoughts that can interrupt sleep patterns and assist with natural treatments for insomnia. As scientists learn more about the links between good sex, our brains, emotions, and the body functions, they are confirming the linkage between sex and longevity. A good sexual relationship is essential for good health, says Dr. Barbara, a psychiatry professor who founded the Human Sexuality Program at Cornell Medical College in New York. Drugs are not the answer for this problem. There are natural, certainly that there are better answers, and marijuana is perhaps the only drug that is safe for women to help them relax and treat hypoactive sexual desire disorder than chemically based drugs created by man and women. I realize that there's demand for this drug, but I encourage women to try natural approaches to hypoactive sexual desire instead of toxic drugs that can damage their bodies and the environment, especially since it's highly related to SSRIs, and SSRIs have been recently controversial in the news about how it affects the brain.